If you're over 60, there's a good chance your kidneys have already been sending you warning signals for months, maybe even years, without you realizing it. Not loud alarms, not sharp pain, just small, quiet clues that are easy to brush off as getting older or just being tired. And that's exactly what makes this so dangerous. By the time many people notice something is truly wrong, their kidneys may have already lost a significant amount of function. Today, we're going to walk through 7 of these silent warning signs, one by one, so you know exactly what to watch for and what to do about it. Some of these might surprise you. One of them, in particular, is something almost everyone dismisses as harmless. Stay with me, because by the end of this video, you'll have a clear, practical checklist you can use for yourself or for someone you love. Let's talk for a moment about why this matters so much for people in their 60s, 70s, and beyond. Your kidneys are 2 fist-sized organs sitting just below your rib cage, and their job is far bigger than most people realize. They filter your blood, removing waste and extra fluid. They help control your blood pressure. They keep your bones strong by managing calcium and vitamin D. They even help make the hormone that tells your body to produce red blood cells. As we age, kidney function naturally declines a little, even in healthy people. But when that decline speeds up because of high blood pressure, diabetes, certain medications, or simply years of wear and tear, the kidneys often don't complain loudly. They tend to fail quietly, which is why doctors sometimes call kidney disease a silent condition. This is precisely why understanding these 7 signs is not about causing worry. It's about giving you the tools to catch a problem early, while there's still time to slow it down or even stop it. Let's start with the first sign, and it's one that catches almost everyone off guard. Sign number 1 is unusual fatigue that doesn't improve with rest. Now, everyone gets tired sometimes, especially as we get older. But kidney-related fatigue feels different. It's a heavy, persistent tiredness that lingers even after a full night's sleep. Here's the simple science behind it. Healthy kidneys produce a hormone called erythropoietin, which tells your bone marrow to make red blood cells. Red blood cells carry oxygen throughout your body. When kidney function drops, erythropoietin production drops too, which means fewer red blood cells are made. Less oxygen reaches your muscles and your brain, and the result is a bone-deep exhaustion that no amount of coffee or naps seems to fix. Think of it like a delivery truck company suddenly cutting its fleet in half. Even if every truck still runs perfectly, there simply aren't enough of them to get all the packages delivered on time. Your body experiences that same kind of shortage, except the packages are oxygen molecules your cells desperately need. Many people mistake this for simply getting older, or blame it on poor sleep, so they never think to mention it to their doctor. If you've noticed a new kind of tiredness, one that feels different from ordinary aging fatigue, it may be worth bringing up at your next checkup, especially if it's been going on for several weeks. Now, here's something that ties directly into our next point, and it involves a part of your body most people never associate with kidney health at all. Sign number 2 is swelling in the ankles, feet, or hands. Doctors call this edema, and it happens because struggling kidneys lose their ability to properly balance sodium and fluid in your body. When that balance is off, fluid leaks out of your blood vessels and pools in the tissues, usually settling in the lowest parts of your body first, which is why the ankles and feet are often the earliest places you'll notice it. A simple way to check is to press a finger gently into the skin above your ankle bone. If it leaves a small dent that takes a few seconds to bounce back, that's a sign fluid may be building up. Many older adults assume this kind of swelling is just from sitting too long, wearing tight shoes, or standing on their feet all day. And sometimes that's exactly what it is. But when the swelling becomes a regular pattern, especially if it appears in both legs at the same time or shows up alongside other symptoms on this list, it's worth paying closer attention to. Think about a sponge that's already fully soaked with water. No matter how much more water you pour on it, it simply can't hold any more, and it starts to overflow. That's similar to what happens in your tissues when your kidneys can no longer manage fluid the way they used to. We're only 2 signs in, and already there's a pattern forming here that connects almost everything on this list. And it has to do with what your kidneys are actually built to filter out. Let's look at sign number 3, because this one shows up in a place most people never think to check. Sign number 3 is changes in urination. This is a big one, and it actually covers several related clues, so let's break it down simply. You might notice foamy or bubbly urine, which can be a sign of protein leaking into your urine, something your kidneys should normally be filtering out and keeping in your bloodstream. You might notice urine that looks darker, or occasionally has a pink or brownish tint, which could point to blood that shouldn't be there. You might also notice you're urinating more often at night, a pattern doctors call nocturia. Or you might notice you're urinating less than usual overall, even though you're drinking the same amount of fluid. Here's an easy way to picture what's happening. Imagine your kidneys as a very fine coffee filter. A good filter lets the water through while keeping the coffee grounds out. When that filter develops small tears or weak spots, some of those grounds start slipping through into your cup. In your body, the grounds are things like protein and red blood cells that are supposed to stay in your bloodstream, not end up in your urine. Now, to be fair, some of these changes can have simple explanations, like a urinary tract infection, dehydration, or certain medications. But persistent or unusual changes in your urine, especially foaminess that doesn't go away or any sign of blood, deserve a conversation with your doctor sooner rather than later. Here's something interesting many people don't expect, and it's related to a symptom most of us associate with completely different parts of the body. Sign number 4 is persistent itching, especially on the arms, legs, or back. This might sound strange at first. What does itchy skin have to do with your kidneys? But it actually makes a lot of sense once you understand the underlying cause. When kidneys aren't filtering waste products efficiently, those waste products, including a substance called urea, can build up in your bloodstream. Some of that waste ends up being deposited in your skin, which can trigger persistent, sometimes intense itching that doesn't respond well to lotions or typical skin treatments. Unlike ordinary dry skin, which tends to improve with moisturizer, kidney-related itching often continues no matter what you put on your skin, because the source of the problem isn't on the surface. It's inside your bloodstream. This is one of those signs that's incredibly easy to dismiss, especially for older adults, since dry, itchy skin becomes more common with age anyway. But if you've tried the usual remedies, moisturizing regularly, avoiding hot showers, using gentle soap, and the itching just won't quit, it's worth mentioning to your healthcare provider, particularly if it's showing up alongside any of the other signs we've talked about today. Before we get to sign number 5, I want you to keep something in mind, because it's going to matter a lot for the next 2 signs we cover. Your kidneys and your blood pressure are locked in a two-way relationship. Poor kidney function can raise your blood pressure, and high blood pressure that isn't controlled can, over time, damage your kidneys even further. It becomes a cycle, and understanding that cycle is key to understanding sign number 5. Sign number 5 is high or hard-to-control blood pressure. If you've been managing high blood pressure for years with medication, and it suddenly becomes harder to control, even though you're taking your medication as prescribed, that's worth paying attention to. Here's why this connection exists. Your kidneys help regulate blood pressure by managing the balance of sodium and fluid in your body, and by releasing a hormone that helps control blood vessel constriction. When kidney function starts declining, this regulation system can become less effective, which often shows up as blood pressure that's more stubborn than it used to be. Picture your blood pressure control system like the thermostat in your home. Under normal conditions, it keeps everything at a comfortable, steady temperature. But if that thermostat starts malfunctioning, the temperature can swing unpredictably, no matter how you adjust the settings. Your kidneys play a similar thermostat-like role for blood pressure, and when that role is compromised, the numbers can become harder to manage. If your blood pressure readings have become less predictable lately, This is a good reason to bring it up at your next doctor's visit. And it ties in closely with our next point. Sign number 6 is a loss of appetite, along with a persistent metallic taste in the mouth. This is one that people rarely connect to kidney health, but it's actually quite common in the earlier stages of declining kidney function. As waste products build up in the bloodstream due to reduced filtering, it can affect your sense of taste and your appetite. Some people describe it as food simply tasting different, less appealing, or even having a faint metallic quality, almost like sucking on a coin. Over time, this can lead to eating less, which for older adults carries its own set of risks, including unintended weight loss and nutritional deficiencies. Imagine trying to enjoy your favorite meal, but every bite tastes slightly off in a way you can't quite explain. Naturally, you'd probably eat less of it, and you might not even connect the dots to anything happening internally, since taste changes feel so disconnected from something like kidney function. If you've noticed your appetite fading or food tasting unusual lately, and it's been going on for more than a few weeks, this is worth discussing with your doctor, especially in combination with any of the other signs we've covered so far. Now we've arrived at the 7th and final sign, and this one is often the most overlooked of them all, because it hides in plain sight, disguised as something almost everyone experiences from time to time. Sign number 7 is trouble concentrating, along with dizziness or a foggy feeling in the head. When kidneys aren't filtering waste effectively, toxins can build up in the bloodstream and eventually affect brain function. This can show up as difficulty concentrating, memory that feels a little fuzzier than usual, or spells of lightheadedness, particularly when standing up. Anemia, which we talked about earlier in connection with fatigue, can also contribute to this fogginess, since your brain relies heavily on a steady oxygen supply to function clearly. Think of your brain like a computer that needs a clean, steady power supply to run smoothly. If that power supply becomes inconsistent, dipping and surging unpredictably, the computer starts to lag, freeze, or behave unpredictably. Your brain can respond in a similar way when it's not getting the steady, clean blood flow and oxygen it needs. Because mild memory changes and occasional dizziness are often chalked up to normal aging, this sign is frequently the last one people think to mention to their doctor, even though it can be an important clue when it appears alongside the other symptoms we've discussed today. So let's bring this all together. The 7 silent signs are unusual, persistent fatigue, swelling in your ankles, feet, or hands, changes in your urination, including foaminess or unusual color, persistent itching that doesn't respond to typical skin care, high blood pressure that becomes harder to control, loss of appetite paired with a metallic taste, and trouble concentrating or unexplained dizziness. On their own, any one of these could have a completely harmless explanation. But when several of them show up together, or when they persist for weeks without an obvious cause, that pattern is worth taking seriously. Now let's talk about what you can actually do with this information, because awareness alone isn't enough. Practical action matters too. First, consider asking your doctor about a simple blood test called eGFR, which estimates how well your kidneys are filtering waste, along with a urine test that checks for protein. These are common, inexpensive tests that can catch problems early, often years before symptoms become severe. Second, if you have diabetes or high blood pressure, both of which are leading causes of kidney damage, staying consistent with your prescribed treatment plan is one of the most powerful things you can do to protect your kidneys long term. Third, pay attention to your hydration, but don't overdo it. Reasonable, steady fluid intake throughout the day supports healthy kidney function, though your doctor can advise you on the right amount for your specific situation, especially if you already have some kidney or heart concerns. Fourth, be mindful of over-the-counter pain relievers like ibuprofen and naproxen. When used occasionally, they're generally fine for most people. But regular, long-term use can put extra strain on aging kidneys. So it's worth talking to your doctor about safer alternatives if you rely on them often. Fifth, try to keep your sodium intake in a reasonable range, since excess salt can contribute to both high blood pressure and fluid retention. Two things that place extra burden on your kidneys. None of these steps require dramatic lifestyle overhauls. They're steady, realistic habits that over time can make a meaningful difference. I want to be honest with you about something important. None of these 7 signs, on their own, automatically mean you have kidney disease. Many of them overlap with other common conditions, and some can simply be part of normal aging or unrelated minor issues. This video isn't meant to alarm you or replace the guidance of a qualified healthcare professional. Instead, think of it as a checklist, something to keep in the back of your mind so that if you do notice a pattern forming, you'll know it's worth bringing up at your next doctor's visit rather than dismissing it as just getting older. Early detection is genuinely one of the most powerful tools we have when it comes to protecting kidney health, because in the earlier stages, there's often a real opportunity to slow down or even stabilize the decline through lifestyle changes and proper medical care. Before we wrap up, let's do a quick recap of everything we've covered today. We talked about persistent fatigue that doesn't improve with rest, swelling in the ankles, feet, or hands, changes in urination, including foaminess or unusual color, itching that resists normal treatment, blood pressure that's becoming harder to control, appetite changes paired with a metallic taste, and difficulty concentrating or unexplained dizziness. We also covered practical steps you can take starting today, from simple blood and urine tests to everyday habits around hydration, medication use, and sodium intake. My hope is that this gives you a clearer, calmer understanding of what your kidneys might be trying to tell you, without leaving you feeling anxious or overwhelmed. Now, I'd love to hear from you. Which of these 7 signs surprised you the most? Was it the connection between itchy skin and kidney health, or maybe the link between foggy thinking and blood flow? Drop a comment below and let me know. And if you're comfortable sharing, tell us your age or the country you're watching from. It's always encouraging to see just how many people from all over the world are here, taking their health seriously together. If you found this video helpful, consider sharing it with a family member or friend who might benefit from this information too, because sometimes the people we love are the ones least likely to notice these quiet warning signs in themselves. Thank you for spending this time with me today, and I'll see you in the next video.